Hello and good morning, and thank you all for joining us. Today's session will be focused on the future of infectious disease, protecting our workforce. Today's speakers will be myself, and I am Sylvia Sakalis, Vice President of Clinical Services with Healthy Systems. I've been practicing in group healthcare for about 12 years and in workers' compensation for the past 8. And with me today, I have Seal Jung from the State Fund of Minnesota.
I'm Seal Jung, and I'm Director of Medical Services at SFM Mutual. And I have been in case management, mostly workers' compensation, since 1994. Epidemics of infectious diseases are occurring more often and spreading faster and farther than ever in many regions of the world. Will history repeat itself? A new HIV, a new Ebola, a new plague, a new pandemic are not mere probabilities. So, what are we going to do about it? We need to examine the range of challenges as well as solutions, ranging from medical and technological to the social and political. Now, we'd like to address COVID impact on the workforce. Worksite risk. Essential industries, including healthcare, face a greater risk. At the time of this presentation, that was the case. However, this is another example where things are evolving on a daily basis. There was a recent study that shows they're not at greater risk than the general population. However, we do know that there are some industries that are exposed to higher risk. It is encouraging, though, that we are able to um, do some infection control as they appear to be making a difference when we consider what happened with the healthcare.
So, as we've noticed over the course of time with the evolution of the COVID-19 pandemic, we have all seen the evolving work site, and that has changed significantly since the pandemic, as well as it continues to change as we move forward. Prior to the pandemic, more than three-quarters of the population did not work from a remote environment. Only 6% of the population really did remote work. In June 2020, COVID 19 forced almost a third of entire workers' population to shift to working from a work from home environment when they would not have done so otherwise. And where we stand today, as of October, the most recent numbers show that most of the population is still working at home, somewhere between 13 to 15% of the workers' population.
We know that mental health is continued to rise. During late June 2020, 40% of adults said that they reported struggling with mental health and or substance abuse. We have marked elevated prevalences of adverse mental and behavioral health conditions associated with the COVID pandemic. Highlight the broad impact of the pandemic and the need to prevent these conditions. In October, CDC actually added mood disorders as a list of conditions that put people at higher risk for getting severe COVID. Recent articles also document the increase in domestic violence.
We've also seen with the pandemic and ongoing still today and into the future, there's been a significant loss in the workforce. During the pandemic, low wage and low hour workers were hit the hardest during that recession. In February 2021, a year into the pandemic recession, the US economy remained down 9.5 million jobs, and it's still down 7.7 million jobs today from February 2020, which was the beginning of the pandemic. The losses were the largest among workers in leisure and hospitality, government, education, and healthcare service industries. Leisure and hospitality, along with various populations, including Black women, Hispanic women, and Asian Americans and Pacific Islanders, saw the most disproportionate losses. Education professions within the public sector, as we've all seen, were decimated. Women were significantly more likely than men to supervise homeschooling for their children during the COVID 19 lockdown, according to the Office of National Statistics. And many actually had to quit their job or take significant time away from work. While we've seen some industries slowly recovering, such as leisure and entertainment, others still lag, those being the government, the education, and the healthcare sector.
Now we'd like to discuss some workplace strategies related to risk management. We want to make sure that we're following current public health guidance. We need to often check CDC, OSHA, our state departments of health. Often our chambers of commerce have good resources well that might be available for you as good resources for return to work safety. We want to implement work site safety protocols. Um, CDC COVID-19 employer information for office buildings is a great resource. So we are obviously looking at social distancing, modifying workstations, modifying our meeting rooms, and you need to keep signage for your office updated for people that are in the office to make sure that they are also aware of what the current recommendations might be. You want to take extra precautions for the staff that do need to come into the office. You might consider rotating them. Consider ventilation and HVAC if it can be updated in your work area. We want to clean and disinfect high touch areas. Remind staff with any GI or cold symptoms or temperature to please not come into the office. In addition to educating the staff on the current COVID information and recommendations frequently, you want to make sure that even if there isn't anything new, that you do let them know that there are not any changes, because you want to make sure the staff is very comfortable that you are constantly monitoring this.
Another important consideration that's going to be important moving forward as it relates to risk management workplace strategies is focused around a hybrid remote work model. This is becoming more important than ever. For many workers, COVID 19's impact has depended greatly on one question: can I work from home or am I tethered to the workplace? The quarantines, the lockdowns, the self imposed isolations have pushed millions of workers around the world to work from home, accelerating a workplace environment that had struggled to gain any traction prior to COVID 19. Hybrid models of remote work for some employees are going to be here to stay. What the virus has done is it's broken through the cultural and technological barriers that previously had prevented remote work in the past, setting in motion a complete structural shift to where the workplace is moving to for some subsets of the populations. The potential for remote work is highly concentrated, however, among those who are highly skilled and educated, workers in a handful of industries, occupations, and geographies. Some companies, including our own, have deployed a hotel structure and provided their workers with collaboration tools to support both those who want to work in an office environment as well as to continue to support those who want to work more from a home environment. More than half of the workforce, though, please keep in mind, has little or no opportunity for remote work. When then remote work, what it does, it really risks accentuating some of the inequalities of the working population at a social level.
Vaccine and testing considerations. We know that the OSHA mandate for COVID-19 vaccine for employers is expected very soon. However, we do know that expectations of what will likely be in there are available. SHRM, the HR.org, has a good guide on how to prepare for COVID-19 vaccination emergency temporary standard. So employees are asking, are you going to require vaccine? Does it apply to me as a remote employer? I've heard several legal webinars, and some say that religious exemptions would be accepted. Some say there's additional questioning. So this is kind of going to continue to be many legal challenges. There's already some states that have challenged the required mandate for vaccinations and or testing. The other thing is you want to make sure that you are keeping your staff informed on if they do need to meet, they need to, or they go to outside meetings, what the protocol is, so that they are aware of the current requirements for your workplace.
Now let's take a deeper dive at supporting a remote workforce and some of the important strategies that we've deployed in our organization. And hopefully, those will serve as some tips and best practices for your organizations. I'm going to start out by quoting a well known author and researcher by the name of Malcolm Gladwell. He stated, "The moment of critical mass, the threshold, the boiling point, can be extremely beneficial when initiating a safety culture in your organization. Leverage personalities, build and streamline your communication, understand the impact for each department, and engage with employee feedback." As a business, Healthy Systems has had a responsibility to our payer clients, claim staff, and the well being of injured workers that we collectively serve. However, we're also an employer who maintains an unwavering responsibility to our employees. And as such, over the last 20 months, we found ourselves navigating an uncharted water as it relates to managing an employee workforce that is remote amid a pandemic. While we've had a lot of success, we have had some learnings along the way that I'd like to continue to share with you. Two major components that we found to really be supportive in helping our workforce stay informed and engaged consist of transparency and trust. These are the core competencies and the core major tenets of our organization, because we all know that employees who work for high trust organizations are much more likely to be productive and energized at work and collaborate better with their employees, therefore having increased productivity. Early in the pandemic, we did a number of different surveys for our workforce, and a lot of the positive feedback that we received centered around the fact that our leadership team genuinely cared about the health and safety of our people. We believe that was a significant impact on building and continuing to maintain trust with our workforce. A few nuggets to share with all of you that we found to be successful along the way. Number one, and most importantly, communicate with authenticity and intention and communicate regularly. This will help to alleviate any employee anxiety during these difficult times and other potentially difficult times down the road. We deployed regular town halls across the organization, various internal social media platforms, employee bulletins, and a variety of means of communication to ensure that employees stayed abreast of our current policies and expectations. We also deployed different modalities of communication. Obviously, everything had to be done in a virtual environment, but we try to get creative. We try to have virtual coffee hours, virtual happy hours, virtual surveys, as well as virtual fun activities such as games. The second key tip for all of you was to foster togetherness even when we were not able to physically be together. That really helped to facilitate a connected culture in our organization. Some of the solutions that we deployed involved a combination of technology solutions to drive collaboration, so collaboration tools such as Microsoft Teams, Microsoft other options, as well as Zoom, different technologies that help to people to be able to stay connected virtually. We also deployed internal recognition programs. We also deployed virtual games and greeting cards. And we did a lot of additional fun activities, such as watching some of our favorite local team sports as an organization in a virtual environment. The third tenet that we found to be really successful was to continue investing in our people, as well as investing in product innovation. But from a people perspective, with the challenges that we were experiencing through the pandemic, we found that trying to continue to maintain some normalcy at home through their office setup was crucial. We allowed our employees to utilize some of our current tools that we had in house, such as a stand up Veridesk, to really try to promote a health and well being culture during their home environment. Pandemic aside, 2020 was really a pivotal year for us for multiple other reasons. Most importantly, focusing on bringing racial inequality to the forefront of our conversation. We were able to deploy a formal diversity, equity, and inclusion initiative, which really brought some structure and some collaborative learning across all levels of our organization. This allowed all of us to take a journey for self discovery, to be able to understand how to continue to foster an inclusive culture and how to best represent and respect different cultural values that our people hold close. A practical way which did that was by deploying a floating holiday to be able to provide our employees an opportunity to celebrate a day that is meaningful personally to each of them. Working remotely actually also expanded some learning opportunities that we previously never had. A key focus for us was supporting a culture, a never stop learning culture. We were able to do monthly lunch and learns. People were able to attend some virtual conferences that had not been able to do so in the past. We have Friday weekly TGIF meetings where we share and celebrate new employees, anniversaries, birthdays, as well as employee milestones and milestones for the organization to bring awareness across the organization. We would never have been able to do so if we had been in a face to face environment. Lastly, I wanted to share with you another learning that we had from a recruitment and training standpoint. In the past, we had delivered all of our training face to face with our employees, as well as our learning and development team.
Now I'd like to cover some employee wellness. Our company was actually quite good at doing employee wellness, but we had to learn to be able to provide some of these opportunities that we would have as we were mostly in the office prior to COVID, and do that in a virtual basis. CDC noted that there are considerably elevated mental health toll from COVID. 2 in 1 Americans are struggling with mental or behavioral health issues. And there was a substantial increase of anxiety by 55%. So obviously this is affecting our, not only our workforce, but our coworkers. So I thought that was a pretty staggering number. We had used to have yoga in our offices, so we have virtual yoga now available. They record it if you're not able to do it during the scheduled live time. There are medication apps or classes that would be available. We used to have healthy snacks in the office and with a brief description of nutritional benefits. We can't do that. So what we've done is they would offer information on nutritional snacks as well as healthy recipes and encourage employees to take a picture of these recipes when they made them. Our local arboretum offered a virtual cooking class using healthy seasonal ingredients that employees could attend remotely. We opened up on our intranet a very easy way and gave instructions on people to post their pets. As we know, pets have very positive experience and are really good for anxiety and create a positive feeling. And we had lots of employees, like I'm sure every other place, that actually got new pets. We had lots of puppies and kittens. You want to make sure that you post any other resources for your employees that might be available related to stress, anxiety, mental health. Our company actually added one that you could do virtual financial planning and address financial issues all virtually. Because we used to have somebody come into our offices and meet with you personally, and obviously that's no longer happening. EAP is a very underutilized resources, and this is prior to COVID as well as I'm sure it still is now, from my understanding from information I have from our HR. But you want to make sure that you're informing employees on how to access EAP. A lot of plans actually have a few free sessions available, so you want to advertise that if that is in fact the case, and make them be aware that EAP actually has lots of benefits that they can provide you. And so I encourage them to use this benefit.
Now let's talk about the importance of supporting impacted employee populations. Workforce loss and labor supply challenges can be felt in every industry. The Labor Department's most recent job openings and labor turnover summary suggests that roughly 4 million Americans are quitting their jobs each month, and a trend that has become known as the Great Resignation. Flexibility remains a top priority. There's two main reasons why people are leaving their jobs. Number one, they felt their employers did not understand them and they weren't providing empathy. And that is especially true for working parents, male or female. They didn't feel good about the experience at work and they're looking to leave their current employer. The second thing that people stated was that they were really leaning into flexibility, whether that's flexibility by location, by when they work, or how they work. They want to leave if their employer is not providing that. This was very interesting statistics. Approximately 41% of those that were surveyed say they're considering leaving their job because their company has not cared about their concerns during the pandemic, and a whopping 76% say they want their company to make permanently flexible in terms of scheduling and or location. Wage considerations are also a significant need for the new working populations. Of the roughly 50% that are currently employed who intend to make career changes because of the pandemic, 41% are seeking flexible and or remote work, with 39% desiring a raise or a promotion.
Evolving work-life balance. According to a study by Fidelity, when evaluating job offers, 58% of millennials and 53% of Gen Xers cite improved quality of work-life balance is more important than financial benefits. Work-life balance can be very difficult in this environment because now most of us would come into the office, more or less normal office hours, but now we have 24 access at home. So employees need to be encouraged to still set limits on their work hours so they don't burn out. A lot of us are not taking, or we're not taking vacation time. You need to be encouraging people to take time off, even if they're not traveling. Short breaks should be encouraged throughout the day as we no longer have water cooler conversations. Managers need to practice what they preach. Friendly reminders that these habits actually make us more productive, not less. Consider no meeting times to let employees catch up on their task, because a lot of us have meeting after meeting, either on Zoom or whatever platform your company is using, and it's hard for us to get to project work. Give employees time to volunteer. There's ways that we, at our company, we have you come by and you pick up the supplies, and then you actually bring back the completed volunteer project. So you actually do it at home, but you allow time for the employees to travel to and from and actually work on these volunteer activities. And we too have done frequent surveys to get employee feedback on what's important to them. We want to make sure that that is being considered. Sick leave policies, have some of the paid leaves and stuff have expired, but you do want to inform employees of sick leave or other options they might have, that more and more of these have come about due to COVID, due to kids being home, not in school.
Now we're going to talk a little bit more about COVID and injured worker management. We'll start out by discussing clinical considerations.
What treatments and specialists are appropriate for those who need care? Pulmonologist, infectious disease, cardiology, neurology. Medication recommendations continue to evolve as well. A lot of these are specialties that in the typical workers' compensation realm, we don't often work with these type of specialty providers. Long haul COVID is not a condition that has accepted objective or diagnostic test or biomarkers. So addressing long haul COVID condition effectively is going to be an extended and complex endeavor for the medical provider as well as the patients. The number of conditions that we think are probably related to long haul COVID continue to evolve, as well as we're not really sure the length on how long these will last.
From an access to care standpoint, as we all seen through the COVID-19 pandemic, that has changed how it looks significantly. Most people are afraid to go into hospitals to get COVID, to get other infectious diseases, and therefore they're seeking care at home. And so telehealth adoption has increased significantly. Post COVID-19, what we're seeing is that while telehealth has decreased, it's still getting to a place of equilibrium, and it is here to stay. From a therapy standpoint, I often joke, and even getting ready for today's presentation was challenging because it is such an evolutionary process that requires constant keep up with the information. There's a number of different factors that affect therapies and appropriate therapy treatment for COVID patients based on disease severity. A lot of these include steroids, the vitamin cocktail that includes zinc, vitamin D, and vitamin C. It also includes monoclonal antibodies. There are things that are not included, things like ivermectin, that I'm sure most of us have heard a lot about, which is an antiparasitic. Hydroxychloroquine is still a no. Fluvoxamine, which is an antidepressant, has some conflicting data. However, NIH guidance still stands by their stance that there's insufficient data to recommend it either for or against treatment with it. There's still biologics being utilized and immunosuppressants. But most importantly, there's a new focus not only on vaccines and expanding vaccine access, but on looking at actual treatment for COVID 19. There's a new drug in development that probably most of you have heard of through Merck. It's going to be an oral antiviral for mild to moderate COVID 19. So that's the current update as it stands at this particular point in time.
We have occupational accommodations to consider. ADA.gov does have a publication out on guidance on long COVID as a disability under ADA. It states an individualized assessment is necessary to determine whether a person's long COVID condition or any other symptom substantially limits major life activity. The CDC and health experts are working together to better understand long COVID and several conditions that would qualify are fairly well established, but I expect that list will likely expand. Education of claims and nurses is important, as we need to be encouraged to have treatments reviewed for appropriateness, even if it doesn't seem like it's related to COVID, as a list of long COVID symptoms continues to grow. Education for all is involved as it continues to evolve on a daily basis. Mental health impacts. PTSD can occur after severe respiratory syndrome, according to JAMA. This study found PTSD prevalence of 30% after acute COVID-19 infection, which is in line with survivors of other coronavirus illnesses and comparable with other types of collective traumatic events. Healthcare workers, violent attacks have tripled. We also hear of stories of people on the airline staff being assaulted. So obviously there has been this isolation, and mental health and stress and anxiety has definitely impacted us all. Even if you have not been infected with COVID, the actual fear of it is real. Claim staff support. We just need to make sure that we're keeping everybody informed on the most current CDC, OSHA, State Department of Health guidelines on a regular basis. Mandatory vaccine requirements from OSHA will be released soon, so we'll need to make sure that we're keeping it updated, because that actually varies state by state. And you want to make sure you keep the staff informed of any changes. Does your state have a COVID-19 presumption for workers' compensation? Is that rebuttable? What does that mean? What occupations does it cover? When does it expire? Are your percentages close to what your state is reporting? Prior to the COVID-19 pandemic, definitions of occupational illness were typically narrow and applied primarily to specific jobs with the risk exposure that outweighed the risks from the general population. However, there are legislative trends arising from COVID that have extended how states are viewing communicable disease and where responsibility lies. The language varies from state to state, but trends indicate a wave of proposed and approved legislation allowing for more communicable disease to be accepted under workers' compensation.
Looking at acute versus long haul COVID-19 illness becomes more and more important every day because it is also evolutionary, just as the treatment options are as well. Will COVID-19 become a new comorbidity? Will it compound pre existing comorbidities and delay return to work and recovery? Some of the actual effects seen from long term haul COVID to date have been reported include brain fog, long term respiratory impacts, heart effects, impacts on joints, esophageal defects, GI defects, and mental health conditions. Thereby, it's going to be continually important for all of us to stay abreast this very important virus that can have long-term effects on our injured worker population.
Internal vendor and partners. What medical personnel do you have available to review the medical records? What outside resources might you have? A psychologist, a pharmacist? Do you have physicians? Do you have nurses? You'll want to identify those. And what functional impairments do the medical records document related to COVID? As you know, this is ever so important in workers' compensation. Do we need prior records? Is it exacerbation of the pre-existing injury or illness? Claims will need assistance on reserving and MSAs for long COVID claims as ongoing medical care is needed. And again, this is a new diagnosis, so this will definitely be where they need a lot of support. We want to create and utilize a COVID template to make sure that your staff knows how to investigate and they have questions that they ask. Why do you believe you were exposed? When did you become aware of your diagnosis? When were you tested? Do you have documentation? Because in the beginning, some of us didn't, the test wasn't available. Did you provide your employer a copy? When did you become symptomatic? When was the last time you were in contact with the COVID-19 source? Were you and the suspected source using personal protective equipment? Were you within 6 feet for 15 minutes or more? Have you or anyone in your household attended sports events, concerts, churches, weddings, large gatherings? If so, how many were there? Have you been vaccinated? Date of doses? If not, does your employer require it, or is it voluntary? If it's suspected, to ask the employer to investigate the employee was exposed to the patient, coworkers, or et cetera, who were tested and when. If unable to reach the employee, what we did was we actually sent a letter to the employee asking the above questions because we knew it was in everybody's best interest to get these claims determination done just as quickly as possible.
And now we just want to leave you with some parting thoughts. Starting out with keeping an adaptive mindset, as I've kind of shared over and over, this is a very evolutionary process, and information continues to come out on a daily, sometimes hourly basis. Medical knowledge and guidance will continue to evolve, and we all have to be flexible in developing key strategies to adopt for our employee workforce.
We want to keep staff informed, keep them apprised of current return to office plan, keep them apprised of the current happenings and most recent information from our public health sources, and be very transparent in any changes that you make and why you're making the changes.
We want to prioritize employee needs. We want to be able to provide them with all the most timely resources so we can maintain collaborative team environments. We want to address any of their anxiety and concerns on a real time basis because mental health is very crucial to return to work.
We want to make sure that we acknowledge as an employer that we recognize we're all in this together. We realize that it's been a lot of new information, a lot of additional workloads, and that we appreciate all that they've done and the support that they have brought to it, as well as a lot of people. Not everybody is very comfortable working remotely, and so that's also been a struggle for some of our employees. So we want to recognize what everybody's done to do their best to handle these in a timely and efficient manner.
So that concludes our presentation. We do see a question in the chat that we
Want
can
me to take that?
address.
Um, and I have to say, and maybe Sylvia's experienced the same thing, we actually had already had lots of alcohol sanitizer stations. We did not have masks, but our social distancing so much, but we also had at flu season, we had signs around the office. If you're sick, don't come into the office. We had signs in the bathroom about good hand washing techniques even before COVID. So I agree with you. I think it's super important that we continue to reinforce that. I do think from our experience in our offices, and I think that's probably a likely feeling, is I think prior to COVID, I think people were more apt to come into the office when we do, perhaps when they're ill. And I do think people are going to think twice about that again. But that's my personal thought, and I know that's thoughts of others.
The only thing I would add is more from a clinical standpoint. If you are at higher risk for flu complications, similar to being at higher risk for COVID-19 complications from any virus for that matter, I do recommend vaccinations as a preventative measure. And I also want to support some of the comments that Seal shared, which is be flexible with your employees, because I think the reality is if they come to work and they're sick, you're not necessarily even getting the productivity that you need out of them, and you're putting others at jeopardy as well. So just be conscientious of the fact that sometimes being an empathetic employer goes a long way, as I shared with you earlier, because that continues to build trust and loyalty and productivity overall. And we'll take any other questions if you have them in the chat. There's another question. Are there any other variants on the horizon that either of you are aware of? So when we first wrote our presentation, which was our speaker notes in the summertime, there were 10 known variants, but what I was reading in my clinical pharmacy CE education is that new variants literally can come out daily or weekly throughout the world. And so there's definitely going to be an evolutionary process to this virus, as well as other viruses similar to the flu. It's unknown at this time. I did hear that there was a strain called Delta Plus that had actually come out in the summertime, but now it's more coming to the forefront. It's not as virulent as the current Delta strain. However, they're keeping an eye on it. But again, I think a lot of the preventative measures that are being shared across the board for viruses in general will help you to try your best to prevent yourself from getting exposed.
And the good news is our Minnesota Department of Health does a good job of statistics, and we continue to see is even if you do get COVID, likely the variant, and you're vaccinated, we do continue to see very small numbers of those have to be hospitalized, uh, which is good news. So while it may not prevent, the statistics show that it will likely have you have a less severe case. All right.
Any other questions? We do have about 5 more minutes.
All right. Well, thank you, everybody.
Thank you for your time and your participation.